Greetings and a virtual warm welcome to everyone. Join us from various corners of the digital realm. Today, we are going to discuss about the topic navigating the MD program at Texila American University, a comprehensive overview. I'm glad to introduce the speaker of the day, Dr. Dheeraj Bansal, Chief Academic Officer in Texila American University. Dr. Dheeraj Bansal is a rector academic with over 2 decades of experience in the healthcare field. He is adept and providing academic and technical guidance to students and the institutions at large. In his previous roles, he has been instrumental in overseeing the functioning of the institution as member of the executive committee and also served as a key member of the quality assurance committee. As a skilled administrator, academic and leader, Dr. Dheeraj comes with a unique skill set that will influential in the institution's growth going forward. Today he is here to present on the topic navigating the MD program at Texla American University, a comprehensive overview. We welcome you, Dr. Dheeraj. Over to you.
Thank you very much, and very good evening, I guess, for all of you because early morning here. All of you are doing well. I am not here with a formal presentation. I want this to be an interactive session. So, what I will do today, I will tell you something about the MD program, the very basic structure, how we have designed it, what are the different courses that we do, what are some of the special features of our program, and then I would expect you to ask questions because I don't want this to be a monologue that I'm just talking and you are listening. That's not a very effective or even a productive exercise, but I would rather have you ask me questions. So I will do a brief introduction of the program. After that, I would request if you are comfortable, turn on your camera, turn your microphone on, and then ask me questions. I think that way this session will be much more interactive and much more effective. So at Texila American University College of Medicine, we offer the MD program. We do have a pre-med component to it, which you will be joining for a period of 1 year. We introduce you to the very initial courses of the MD program. Once you have successfully completed that and you enter into the MD program, the MD program is divided into two main components. They are called the basic science component and the clinical science component. Some of you might know this already, but for others who don't know, let me just briefly explain what these components are. Basic science components consist of the basic medical subjects. We start with anatomy, histology, embryology, neuroscience, then we move on to biochemistry, physiology, microbiology. From there, we move on to pharmacology, pathology, basic psychiatry, and behavioral science. So the basic science is designed as that you start with anatomy, histo, moving on to physiology, and finally ending up with, once you finish the basic science component, we offer comprehensive exam at the end of basic science. Now, this comprehensive exam is a standardized exam. It is given by NBME, National Board of Medical Examination. If you are not familiar with what National Board of Medical Examination is, it's the same body that creates USMLE exams. Now, the comprehensive exam of basic science, which is known as CBSE, Comprehensive Basic Science Exam, is considered to be the best predictor of your success in USMLE Step 1. What we do in basic science is basically we prepare our students for the USMLE Step 1. And our goal is that by the time you finish the basic sciences program, you are ready to write Step 1. After 4 years of basic science subjects, the very subjects that I told you about, there is a 6 month semester, what we call as transition semester, and now known as MD5. Transition semester is very special because during transition semester we do two things. First, we offer a review course which is known as Kaplan, which is one of the best known review course for success in USMLE. Offer the entire course in transition. So what it means is that you get to revise your entire basic science curriculum once again, and hence your success rate in USMLE Step 1 comes really, really. Second thing we do in this transition semester is that we invite the clinical faculty from the hospital. I'll talk about that when I talk about clinical sciences. The very faculty who are going to teach you during your clinical rotation, they come to the campus and they teach you the basics of. So you are doing two things. You are not only preparing for your USMLE step one, if you want to take that, and your exit exam, basic science, which is the CBSE exam, the NBME exam I was talking about. Not only you're preparing for that, you're also preparing well for the challenges that you're going to face when you go for the clinical science exam. In these subjects that I mentioned in basic science, we are very sensitive to train our students better for their clinical journey. In other words, it means that we want our students to have very good clinical skills. And hence, we introduced a course known as Doctor Patient Relationship, in short form DPR. DPR runs MD1, MD2, MD3, MD4. We have a basic science. And in these DPR courses, we start with the very basic clinical skills such as history taking, and then we move on to physical exam. And by the time you reach MD4, you're also talking about basic investigations that you order and how do you treat the cases. This course runs through the entirety of the basic science. So again, you can see it's a continuous ongoing thing. So by the time you reach transition and you're ready to go to your clinical rotation, not only you have all the required clinical skills, but you are being taught by the very clinical faculty who will be teaching you in your clinical. Other than that, another highlight of our basic science program is that we take research experience very seriously. I don't know how many of you are planning to go for USMLE and residency in US, or for example, lab or the entrance exam in Australia. Doesn't matter wherever you're applying. Research experience is really, really important, and it makes your CV look good, and you have an edge above other who might have performed as good as you have. And so we have introduced a course known as research methodology in MD1 and MD2, in which we conduct a research activity, and the end product of that is that you end up publishing paper. So if you are willing to work hard and if you put in your time and energy and focus, you should be able to clear USMLE step one and have at least one or two publications. Besides these things, we also have a lot of community activities. We engage our students going to old age care home, primary health center, psychiatric clinic, a surgical unit in a local hospital. These are all kinds of exposure you will be getting while you're in basic sciences program. So once you have passed the basic science, then you move on to what we call as clinical science. Now, for clinic, you have two options. Either you can do all your clinical rotation here in Guyana itself, the largest hospital of the country, tertiary care hospital. It's a 600 plus bedded hospital with all the specialties and super specialties. You can do all the rotations there. And as I told you, with the very faculty who are coming and teaching you in your transition semester. Second option is if you are really serious about taking USMLE and applying for US residency, then you have the option of doing all your rotations in Tucson Medical Center in a city called Tucson, which is in the state of Arizona, which is right very close to Las Vegas. And you can do all your rotations there itself. So we have two clinical sites, as we call them, one GPHC hospital in Guyana and the Tucson Medical Center. It's a huge hospital again, very, very huge tertiary care hospital. It's a green book hospital. You can do all your rotations there. And again, process is same. You do your rotations, and then you take an exit exam, again NBME exam, which is again a very good predictor step to clear the exam. And if you do well on the exam, you are ready to write step. So, in a nutshell, our effort is that by the time you finish basic sciences, you're ready for step one. And by the time you finish clinical sciences, you're ready for step two. And by the time you graduate, you already have step one, step two with you. And you finish. And then, depending what you want to do, whether you want to come back to India and write your FMG, or you want to write step one, step two, or you want to write lab, that would be depending on what your career goals are. So, this is a basic preview of what the entire MD program is about. I would also like to mention that all the main subjects in basic science and all the main rotations, such as surgery, medicine, OBGYN, pediatrics, psychiatry, family medicine, these are the four rotations. All the exams are NDME exams. We don't write the exam, the exams come directly from NDME, which is a preparation well done for your performance in your step one, step two exam, if you want to write those. So this is a brief preview of the curriculum. Other than that, we have a student council with representation of students from each semester, and I personally meet with them once a month. And there we discuss what kind of student activities you want to do. So I have given all the responsibility to the students. They come to me and say, we want to do this and we want to do that. And they come with brilliant ideas. Recently, they have come up with a bake sale and they donated the money to one of the charities. Students conduct a sports day. We have a competition for sports activities. We have a cultural night. Recently, a month ago, we had a cultural mingle in which students from different countries, they brought their own country food. They came in their country's national dresses and they sang songs from their country. So it was a very, not only an entertaining afternoon, but also very good learning activity as well, because we learned about different cultures and from different ones. So these activities go hand in hand. We have academic activities, we have cultural activities, and we have sports. This is a basic insight into the entire program. All our faculties are qualified faculty. We take this very seriously. They have significant experience about the subject they have been teaching. They are experts in dealing with multiple choice questions because most of the licensing exams are MCQs, and we have MCQ sessions inbuilt into the semester. And we train our faculty from time to time to ensure that they expose you to well-designed multiple choice questions which are in line with the kind of questions you'll be facing in your exams. So that's kind of an insight. I would like to hear some questions from you so that I can address them individually. So go ahead, please, if you have any questions. Yes, go ahead, Mr. Chandra.
Hello, dear. This is I'm Dr. Chandra actually. Okay. Just want to know, like after these clinical rotations, like either in Guyana or the US, like they will come back to Guyana for the internship or how it is like.
So I don't know how much you're familiar with the USMLE structure. If you write your USMLE and get a residency program in USMLE, you don't have to do internship because internship is inbuilt into the residency program. First year of
Okay.
residency in US is an internship year, so you don't have to do. However, if
So
you
even
want,
though you do the clinical rotations in Guyana, if they can, like if they pass USML step 1, step 2, then they can directly apply for the residency, right?
yes,
It is not
and
necessary that they have to do in the US only clinical rotations, right?
yeah, and let me answer your question in completion. Second part of your question was internship in Guyana. Yes, if you want to come back to India, you can write your FMG exam right away after finishing graduation, and you also have the option of doing internship in Guyana. Spots here, so the student can finish internship in Guyana and then come back to India, or they can clear USMLE and go into residency program directly without doing internship.
Without intern, they can go. That means, right? If
Yes,
they
I
pass the
told you, no,
USML step
the
1, step 2. Yeah, yeah.
first year of US residency program is called internship year. You don't have to do internship before that. All they want is that you have cleared step one and step two and
Okay.
graduated from your medical school.
Okay. So the total course is 5 years, including with pre-med,
Total
right?
is 5 years. Yeah, including 1 year of pre-med is 5 years. Yes, exactly.
Okay. But curriculum is same for the even US curriculum, like main US curriculum only, right? for even Guyana
Exactly.
or circulations
Exactly.
or maybe. Okay,
Exactly
okay,
same.
okay. Are you preparing for the USMLE actually? Are you like
Well, I don't know when did you join my talk. I've been talking about USMLE all along, so maybe you
okay?
joined late.
No,
So yes,
the I mean there is separate classes or anything like concentrating on that. I mean to say like
separate process not needed. The entire process is designed on the USMLE pattern itself.
okay, okay, okay.
I was talking to the audience earlier. All our exams are NBME. Have you heard of NBME? National Board of
Yeah,
Medical
yeah.
Examination.
National Board of Exam. Yeah.
The same. All our subject exam, basic science and clinical science are actually NBME exams. There are around 14 subjects, in basic
Yeah.
science. And if you have done well in
Okay.
NBME exam of every
Mhm.
single course, then obviously when you go and write the step one, it is a combination of all these subjects, right? You
Oh,
don't have to do separately anything for that. The entire curriculum is designed
okay,
for USMLE.
okay, okay. Your people can help for the matching after these steps, or anybody is there? Like, or they have to apply them?
Dr. Chandra, the matching is an automated process. Okay, we
No, I
can't
mean
help
to
with
say
that.
that
Even
guidance, at
somebody
least
sitting in
some
US can't
guidance
help.
will be like recommendations and all that.
Yes,
You
of
will
course.
do that, right? So,
Everything, yes.
because they need recommendations, lot of things. So they're asking.
Everything. No,
Yeah.
it's an automated process.
Okay.
As the dean of the institute, I have to send an MSPE letter,
Okay.
which we have standard. That includes my recommendation also. So it's an automated process. The student doesn't have to come and request
Okay.
for it
Okay.
automatically. So let me tell you a little bit. Maybe you can research on that more. When your child will apply for USMLE, the ECFMG sends an inquiry to us. What about this student? And we send all the details, his performance, academic, clinical performance, and recommendation. It all goes as one package.
Okay.
So
Okay.
student does not have to do anything. All right.
Okay. What about one more thing, doctor? Like this accommodation, like there is Indian mess or anything, they have to cook or something like accommodation wise.
So Guyana, I don't know how much you know about Guyana. Guyana is like a mini India. 50%
Yeah.
of the population here are from India, but 3-4 generations ago when they came
Yeah. Yeah.
here.
Okay.
So there are like temples all around the country. Indian food is freely available everywhere. Even in our campus mess, there's a lady
That's what I
from
want. Like in the
Guyanese.
campus mess, is there Indian food, right? There is Indian food and all that.
What I was coming
Like
to
yeah.
mess, even though she's Guyanese, but since there are so many Indian students, she cooks the Indian meal very nicely.
Okay.
I also lunch there from her only.
Okay. Okay.
Okay. I have a
Okay.
question I am from Africa, Sudan. If I would like to take USMLE, where can I take it, and where can I do rotation of practice? Well, as I was telling earlier, this is Abu Bakr, if I'm right. Abu Bakr, I was telling about this in my initial presentation. You have two options. You can do all your rotations here in Guyana if you want US experience, which is quite significant if you are thinking of applying for US residency. You can do your rotations in US itself. We have a clinical site in Arizona, city called Tucson. It's called Tucson Medical Center. You can Google it. It's a tertiary care, excellent clinical site. You can do all your rotations there. And even before you finish your graduation, if you prepare well, if you work hard, you can write USMLE step to there itself and then come to your home country. Otherwise, there are pro-metric centers in all the countries. There are many in Africa too, in South Africa as well. There are many in India. You can write your exam. I hope that answered you. Any other question? Akshita from India, I had a question regarding electives. Can you please explain about what are electives and when they should be done? Okay, Akshita, here's the thing. When you do your clinical rotations, there are two kind of rotations. One set is known as core rotations, and these you have to do. Okay, you have no choice. These are core rotations, and these core rotations are, as I said earlier, medicine or internal medicine, surgery, OBGYN, obstetrics and gynecology, pediatrics, family medicine, and psychiatrics. Okay, you have to do them. Active rotations, you have 20 plus options depending on what your interests are. We have a surgeon here, Dr. Sheikhamir, who is also associate dean in our school. He works under me. and he sits with each student one on one, and we go through a process of what we call as elective counseling, in which he talks to the students, tries to get an idea of what your career interest. Accordingly, 20 plus of whatever, you have cardiothoracic surgery, you have neurology, you have pediatric surgery. So depending on what your interests are, you can pick those seven as a requirement for graduation. I also mention about extramural elective. Since seven electives are needed, there's an option of doing two electives from anywhere else. So if somebody is from India, they want to go for 2 months, maybe they have not visited, so they can do two electives from India and then come back. It's called extramural elective. Or you want to go to Jamaica, or you want to go to some other place, or you want to do two from US just to gain that experience. So that option is also available. So that's the entirety of electives. Okay. Can you tell me the name of African Medical Board that offer for exam give license? Well, Abu Bakr, you can go online and see and just type pro-metric centers in Africa. So I don't know the entire list. There are a lot of centers. I don't know the entire list. So if you go online and Google it, I'm sure you'll get it right away. Okay, you're welcome, Akshita. Any other questions I have from others?
Well, I don't think there is, as of now,
Hello.
there is no questions. Yeah.
Hello.
Yes,
Yeah,
Dr.
Dr.
Chandra, go ahead. Go ahead, please.
Yes, sir. Only one question. Like after finishing the clinical rotations, if still like a student wants to do the internship in Guyana, they are allowed to do that thing.
Not they're allowed to do. It's most of the students do that.
Okay. So they can.
Those who don't go for USMLE, they all do internship in Guyana. Those who go for
Okay.
USMLE, as I told you earlier, also they don't have to do internship because internship is inbuilt in the residency program in US.
Okay. So after suppose if they want to get the license for the Caribbean, like Guyana Medical Council, they can do the they have to do the internship there, right?
Without internship, as you know, you're a doctor yourself. Body will give you a license. But yes, the
Yeah.
moment you finish your internship, you can apply for registration at Guyana Medical Council, which is a formality, and you
Okay.
get the license to work. Okay.
Okay.
Yes,
Okay. So
Alexis.
yeah, that is better. And one this USML is step 2, step 1. Even though if they don't go to US, also they can do there only, right? After that, they can try for matching. It's not that only who goes to US rotations they have to get the do the things or nothing like that. Right?
Anybody, every single student can write. You can write it from India, you can write from Africa, you can write it from Caribbean, you can write it from US.
Okay. Thank you. Exactly. I appreciate.
Hello. Been very, very interested in having like practicing in Canada, practicing medicine in Canada. I wanted to know if when I graduate from here, will I be able to do that?
Well, here's the thing. I don't know how much you know about it. Getting into Canada is one of the hardest things, even for Canadian citizens. Okay, if serious about getting into Canada, I would recommend that you work hard, clear your step 2, do your residency from US, and once you have done residency from US, you can ride the Canadian boat and move to Canada. That's the best option for you.
Okay. I also wanted to know my residency options. Do I only attend one hospital or we have options we can pick from?
Are you talking about residency or rotation?
Sorry, rotation.
Do from multiple places. Even here in rotation, we try to give the exposure to. I told you we have. I don't know how late you were, but we have two main clinical sites. One in Guyana here, GPHC. One in US Center, Arizona. It's a Greenbrook Hospital, really huge, like state of art. So if you want to do some rotations there and some in Guyana, that's possible too. You want to do the entirety of rotations in Guyana or the entire rotations in US, that's possible too. A combination is possible too, whatever suits your needs. Okay.
Okay. Thank you so much. If I have other questions, I'll ask.
Please do. Yes. Okay. Any other questions anybody has?
Dr. Dhiraj, on behalf of the students, I'm just curious to know about the student support services about at Texila. What are the support services for the medical students, both academically and personally?
So that's a good question, Murli. We have both kind of supports available. So As soon as the student is admitted and walks into the campus, we assign two kind of mentors. One is we call as the student mentor, and coming from Nigeria. We try to find a student from Nigeria itself and make that student as the student mentor of the new student. That way, that student, the senior student, has already been through the process. Being from the same background, knows exactly what are the challenges he faced, so he becomes a very good mentor for the student. Similarly, we assign a non-academic mentor. This is usually a faculty from not the semester that the student is attending, but from a different semester, to whom the student can go and talk about non-academic issues. Other than that, we have an entire department of student affairs, which has an assistant dean, under whom there is a student affairs manager, under whom there are three student coordinators. So student can go and talk to them at any level. I also, being the dean of the institution, have an open door policy. Students walk into my office anytime if they have any issues there, especially when they are new, they might face. These are all non-support that we have. Other than that, we have academic support as well. So as soon as the student is registered into the program, we assign what we call as academic mentors. These mentors are basically from the same semester that the students attending. So the faculty is aware of students' challenges and the issues they have, and they try to resolve them sitting with the student one on one. So these are the student support facilities we have. We also have a panel of external counselors. Sometimes students are not comfortable talking to faculties and students in campus. So we have a board of three psychologists who are external counselors on our panel, and students can approach them as well. My name is Kamba, a medical student at Texas University, Zambia campus. I'm finished with basic sciences and would like to find out if I can transfer to Guyana campus or clinical campus. Kamba, you need to talk to the management at Zambia, and they will guide you. There is a process, I'm aware of that, but we haven't had any transfers yet. Problem is you cannot transfer to clinical sciences directly. If you transfer here, you might have to join in the transition semester, as I talked to you earlier. So, but I would recommend that you go and talk to them first, okay, and they'll guide you. Is there a possibility that parents can live there during the course period? I mean, can we get a visa to live there too? I'm sure you can, but as you can imagine, the visa giving process is not under our control. We can give you a letter of support, and we can help you in that. But I don't think getting visa here is that difficult process. I'm aware of some of the parents who came and lived here with their child for a period of 1 year. Anything else, Murli? Anything else you want to ask?
Yeah, yes, Dr. Zira. Thanks for the previous question that you have answered very clearly. And the second question on behalf of the students that I'm going to ask you about, what are the extracurricular activities happening at our campus?
Well, I alluded to in my talk that I was giving earlier.
Yeah.
We have three categories of activities. We have academic activities, we have sports activities, and we have cultural activities. Academic activities, we like to have fun with quiz. We organize seminars. For example, a student celebrated October and they did presentations, which was very impressive. We very recently finished our international conference on communicable diseases. And I'm happy to say that students from pre-med all the way to basic science and clinical science, we had 20 students presenting posters during the conference. And imagine, even in medical school, they have a poster presentation international conference to their credit. And in this conference, we had experts from US, from UK. It was really on a very large scale. And we do one international conference every year and provide opportunity for our students to present in this international conference. And students attend in large numbers. So these are academic activities. And of course, then there are sports activities. We have sports days every semester in which we have a competition. There is a football competition, there is a volleyball competition, there is a table tennis, chess, indoors. So we have a series of activities, and then we culminate the end with some athletic activities, some fun races. So those are the activities we have. And then cultural activity. So as I was mentioning, we have annual day and we have a culture mingle in which different students from different countries they bring songs and dances from their own country. It was really an awesome experience for me also because we couldn't do it due to Corona in 2020 and 2021, and then so 2022 we were just coming out of it. So this year we did it, and it was a wonderful experience. So these are the stories.
And apart from that, Dr. Dheeraj, about the community engagement, Guyana is almost around 7 lakhs people are living in Guyana. Correct? So, what are the community outreach activities that we are doing it from our medical school?
As I was saying earlier too, we take a community visit to an old age home, to an orphanage, visit to a primary care center, visit to a psychiatric center, visit to a surgical unit in one of the hospitals. These are in the curriculum. So our students went to, I have introduced an activity in transition semester where students go to family care center, which has children who are from troubled family backgrounds. They are aged a few months to 13, 12, 13 years. And our student went there and did their exam, presented to them about hygiene and dental hygiene and things like that. And it was a wonderful experience for them. Other than that, we have a series of community activities which we do. Guyana is a very interesting country. I don't know how much you know about it. So this Georgetown is where our school is located, and that's where the city region is. But then there are many regions outside which are far away, and medical facilities are very very in. So we take our students there, and they interact with the community people. So, but that's voluntary basis. It's not part of the curriculum. So that's also there. We also encourage our students to do community presentations. As I said, that they celebrated Pinktober, so they took out and a march with pink T-shirts and breast cancer signs and all that. So yeah, I mean, it is a lot of community activity that we do. And as I say, we also let the student affairs, student council take the lead. So they come to me and they say that we want to do. For example, one of the students came to me last month and said, I want to organize an event to donate clothes and toys. And we supported her, and she did a very good program where the other families they brought toys and clothes, and then she distributed that to the needy people. So yeah, I mean there are many options.
Okay.
Another question, one more about, can you please tell us about medical camps in between semesters with Republic of Guyana, basic checkups like, yeah, so this is again, as I was, as we call them, in different regions of the country. And usually a doctor go, a couple of clinical students go, and few basic science students who volunteer, they go. And there they, in the camp, they basically do the blood pressure, blood sugar, and the basic health checkup, and then give them advice accordingly. So it's a wonderful exposure for medical students too. And as I said, the community activities are two kinds. Some are built into the curriculum, and some are on voluntary basis.
Sir, the polls has been launched. Attendees are requested to attend the polls. So, any other queries from attendee side, you can raise your hand so that I will allow you to talk.
Hello, sir.
Hello. Yeah.
I have another question, which is,
Go ahead.
When I do decide to get into Texila and 2 years into my Texila, would it be possible for me to transfer schools?
What do you mean by transfer schools?
I mean let's say like my family decides to relocate to a different region and they want me to school in that region. Would it be possible for me to apply to a school and maybe like tell you people I wish to transfer to this certain school? Will I be able to do that?
Well, it depends on the policy of the school. For example, our policies, we don't allow any transfer students in clinical years. But we do have students coming in our basic science. It's not that big a number, but we have had a couple of students coming in, or sometimes even 5 students coming in basic science. And it all depends on, what you have completed and what courses you have taken from your previous school. So yes, transfer is a done deal, but I would, if you are thinking of doing it, or if your circumstances are such, my recommendation would be do it before you start your clinical years.
Oh, okay. Thank you.
No worries. I think that's pretty much it. Amurli, anything else you want to talk about?
like to know about credit transfers to the students who wants to join in the basic sciences middle second semester or third semester. Most of the students nowadays we are hearing about here and there they're transferring from the one medical schools to another medical school. So like to know the eligibility criteria, from your point of view.
So even though the majority, say, as Dr. Chandra was also saying earlier, all the medical courses curriculum are very, very similar. I mean, any medical school you go to, you have to go to same anatomy, physiology, biochemistry. So depending on what you have successfully completed from your previous, first of all, we look at the accreditation record of that school. Because as you know, or you might not know, I don't know, but Texila American University College of Medicine is accredited by
Yes,
CAMHP,
yeah.
which is the local accreditation body in this region. But we are also accredited by a very prestigious accreditation body, Ireland. So obviously, we look at the college that you and what kind of process. We have admissions team here, and they bring it to me with fine. Yes, depending on yes, they can.
Great.
If you are in some other school and you want to transfer Texla, yes, provided you do it via basic science.
Dear attendees, a big virtual thank you to each one of you for making our webinar a success. Your participation, engagement, and enthusiasm were truly appreciated. We hope you found the session informative and valuable. Looking forward to connect with you again in a virtual space.